How to address the issues of the COVID-19 chapter. This is clearly a conversation of significant importance. Over the last couple of years on the Pandemic podcast, we've created somewhere between 400 and 500 episodes examining everything from the science, the data, the politics, to the culture, and the collateral damage and the implications of policy in great detail, with solo conversations looking at data sheets through to looking at news stories, to inviting many different experts to come and give their take on what's been happening over the duration of the COVID-19 chapter. But now, as we move beyond the hysteria and the panic of the COVID-19 period, now is the time to start asking really important questions about what can we do to learn the lessons. How can people be held accountable? And more importantly, how do we move forward from here and find deeper solutions to the issues that we've witnessed to ensure that, A, we move forward and heal the damage that has been done, but also equally important to make sure that something of this nature does not happen ever again in this way. So I'm delighted to let you know about a conversation that we're having tonight at 8 p.m. UK time inside our private network, the Elevate Network. We're going to be examining how we can move forward and looking at a major project that we're about to co-create with our network in order to establish a working group, a coalition, a committee to tackle 5 major issues. So I'm going to very briefly share these issues with you. This is a screenshot from within our community right now. We're looking at 5 key areas tonight, 5 key areas of concern that we wish to examine and pull together a working group involving the academics, the politicians, the various different individuals that have been involved in tackling these issues, activists, organizations. I don't know where politicians came from, the 2 or 3 politicians that stood up. We can count them on one hand. But we're going to be looking at 5 key issues. The public inquiry. Firstly, we've already done a first piece of work in terms of the UK public inquiry and submitting our own extensive documentation to the consultation. That has been received and processed alongside thousands of other people who have submitted evidence. But our goal is to firstly take that framework and expand upon it and create a template that can be used by other nations as they enter their own inquiry process. But more importantly, start to address the question of how do we create a global public inquiry that examines this from a global lens, because of course there's many different institutions, the WHO and other related organizations that have been integral in the way that this has unfolded. So we're looking to support national and global inquiries into the handling of the pandemic, but of course, that includes the vaccine rollout. But of course, we can't rely upon the governments and central institutions to conduct this in a fair and unbiased way. So we're also going to look and explore how we can create a parallel public inquiry at the global and national scale. Again, working with various different organizations, institutions, and individuals from across the world to do this, including how we can involve alternative media or new media and even mainstream media in this conversation. And how we can gather the evidence required to support a public inquiry of this nature. Now, to be clear, Elevate aren't forming an organization to lead this project. We're looking to build a coalition that works together in collaboration with all the different organizations and individuals who are already working on these issues in order that we can create synergy amongst us and synthesize our work. But in many ways be a catalyst for these conversations. That's number 1. Number 2, looking at regulatory reform. Obviously, we've touched upon the vaccine rollout in the first point, but it's very clear that we have a problem that the drug development and approval and monitoring are intrinsically linked to the pharmaceutical industry and wider philanthropic and wider conflicts of interests. So we're going to look at how we can pursue legal and regulatory reform in order to tackle these issues and more. What can be put in place to break these chains. This is a mighty task to take on, given that the scale of might behind the way that the industry is set up, but we have to explore this in order to create change. Number 3, pandemic preparedness. Clearly, we need to challenge the international health regulations and the pandemic treaty put forth by the WHO, but it is clearly evident that once that inquiry process has completed, that there is the need for frameworks for dealing with future events like this to ensure that we don't make the same mistakes again. And again, we want to work with partners across the world to tackle this particular issue. Number 4, global health governance. It's important that we address the corruption and conflicts of interest within the World Health Organization and look at different mechanisms of global health governance, decentralized health mechanisms. The World Council for Health are very much looking at this from the grassroots up approach, but there are other organizations around the world taking a similar approach. And again, we want to help bring together a network of people to address this particular point. And then number 5, biosurveillance. Quite clearly, we've seen the rise of other methods over the last couple of years, and this is only something that's on the rise. So we want to be establishing very clear ethical and practical boundaries to biosurveillance and secure the right to privacy both online and offline for individuals, patients, and the public. So these are 5 very, very major areas of work. Again, we're looking to start the conversation, join the conversation, bring people together, create working groups, create networks, share ideas, share tools, resources, and skills and expertise. So we're looking to build a committee, a coalition around these 5 key aims. There are, of course, other related aims that we must address, looking at the impact on free speech, the impact on the right to protest, looking at human rights. These are all very much connected alongside other issues, but it's very important that we have a focused effort on these key 5 points that have risen from the last couple of years. Now, much of this is rear view mirror facing, understanding what's gone wrong before us, adjusting some of the legal and regulatory elements to make sure that it doesn't happen again. But importantly, as you know, we must find broader solutions to the systemic, cultural, and philosophical elements that have led to this, and that is going to be part of the examination process. But at this very point in time, it is important that we take the opportunity to look at these 5 key areas and do so in a rigorous manner over the next couple of years as we address the issues of the COVID-19 chapter. There's a lot of interest in being part of this journey. So I want to invite you tonight to join us inside the Elevate Network. If you're available, 8 p.m. UK time, you can join us at weareelevate.org. We're hosting a broader conversation about this initiative this evening. It will be recorded, so make sure you're a member of the Elevate Network. We'll upload the replay to YouTube afterwards, but if you can join us live, you can join us in the conversation to help share ideas about how we can make this happen. So that's once again, it's weareelevate.org. If you head to the events tab within the network, you'll find the details of tonight's event, and you can join us live on Zoom from 8 p.m. UK time. So head over to weareelevate.org, join the conversation tonight, and find out how you can support our work to address the issues of the COVID-19 chapter. Thanks for watching. Please hit the share button. Let's get this message out there. It's down to us and the various organizations and individuals who've worked tirelessly over the last couple of years to take this journey forward. And tonight we're going to share just a little piece about how we will play our part in exploring that journey from here forth. So hopefully to see you tonight. Again, if you're not able to join us live, look out for the replay. But 8 p.m. tonight within the Elevate Network, our Pandemic Reform Committee conversation will begin, and we'll explore how we're going to address this. To give you the heads up, we are going to be coupling. This is part of our all network call. We have a monthly call with our entire network the first week of every month on a Wednesday evening. We'll also be addressing a couple of other issues, including some forthcoming events. But the primary focus of our session tonight is on this Pandemic Reform Coalition. So hope to see you tonight, and thank you for tuning in. Please hit the share button. Together we can create change. Peace and love.